Planetary Health First, Mars Next. It is great to have you. Happy Thursday. And we're just going to start off what I should have started. Planetary Health First, Mars Next, a Michael Mann production. We are on a mission to transform healthcare, one where all equally benefit by building a dynamic, robust, diverse community. Join us on this journey. One parsec at a time, we will be transforming healthcare together. Awesome. Well, we are excited. I'm excited. We have an amazing special guest here today, and I am going to start off just by, of course, you see the experience, the differentiator, but we have Valerie. And say your last name for me.
Choniuk. Choniuk rhymes with cognac.
Choniuk. I would have never gotten that right. I'm glad I asked. So it's always good to ask. So we got Valerie Choniuk, and she is the National Director of Patient Experience at Agilon Health. Agilon's health mission is to be trusted long-term partner of community-based physicians, enabling them to reimagine the patient experience for older adults and lead the transformation of care delivery in their communities. She leads enterprise-wide consumer assessment of health providers and systems CHAPS, and the health outcome surveys HOS performance and value-based purchasing efforts for global and professional direct contracting and Medicare Advantage lines of business. She collaborates with leadership. She market with state market executives and 2,400 community-based primary care physicians and advanced practice professionals, and 32 independent medical director groups across 14 states and 31 geographies to focus on the total care model encompassing people, process, and technology to improve patient care experience and overall health and well-being for almost half a million patients. Wow. Valerie's 20 years of experience combined shaping guest, member, customer, clinician, employee, and patient experience from corporate hospitality to across the healthcare continuum, across acute to post-acute care, home health, managed long-term care, and clinical groups. She specializes in the human experience through a psychological approach, focusing on human behavior and creating psychological solutions to meet people where they are. She received her Master's of Public Administration and Healthcare Administration from Marist College, is a certified patient experience professional through the Patient Experience Institute, and a founding member of the PX community. When she is not elevating the human experience in healthcare, she is busy creating memories with her husband and her 3 children. As a lifelong transplant from Empire State of New York to the Sunshine State in Florida, they enjoy a holistic life. And one thing you probably didn't know about her, she lives on 3 acres. She enjoys gardening, juicing, and soaking up the sun. And the last thing you'd never know, she's got not 34, not 31, but 32 chickens. So that is it in itself. That is a differentiator, right?
Yes, sir. You're so funny, Michael.
Yeah. Well, it's so great to have you here today. And
Thank you. It's a pleasure.
awesome. So why don't we start with this whole thing? What do you think healthcare organizations need to do to stand out from their competitors?
Yeah, Michael, I love this question for a few reasons. The first is because I think this question can be applicable to all organizations, right? Not just healthcare, that what do they need to do to stand out? So whether you're healthcare or not, we all serve people. We're all serving humans, patients, customers, consumers, whether they're internal, whether they're external. So to answer this properly, I also want to note for the audience today that my answer is not necessarily what I think. It's actually a compilation of what patients across the healthcare continuum think and what matters most to them. So I think this response will really resonate on an individual consumer level and then obviously on a business one for anybody who provides a service. So what do organizations need to do to stand out from their competitors? They must make people feel different, valued, and special. We truly need to go back to the basics in our interactions. Everybody is so focused on technology right now, so focused on AI, and we need to focus on that behavioral science and how we feel in those interactions, because those feelings, those are what's going to last, and that's what creates our memories. And it's those memories of those experiences, right? This is me getting into the psychology of it, that dictate our expectations and how obviously we experience that experience. And we all know how we ruminate over things over and over again, and then we're likely going to share that experience with others. So when we're thinking statistically speaking, when we look across the board at the voice of our patients or customers, I'm sure people won't be surprised that are listening that, what are they complaining about, especially in healthcare? Systemic wait time issues, right? So thinking about waiting on the phone, waiting for that appointment, waiting in that reception area, waiting in that exam room, waiting for that prescription refill, waiting for my test results, waiting for my follow-up, right? It's all waiting, because in a consumer-driven healthcare world, we want everything yesterday. So they'll also complain about things like lack of communication, right? They want, in respects to feeling, how they are feeling good, if they're being listened to, if we're explaining things in a way that they can understand. And there's also a great deal of friction in regard to things that are just general information and education. So are we talking to them about how to use their portal, how to pay their bill, how to manage their prescriptions, how to select a primary care physician, or how to get a referral to a specialist, or accessing care? At the end of the day, it's so convoluted, it's so comprehensive, it's so confusing. We need to be able to have the ability to just go back to treating people as an individual, right? As a human being, not as a transaction, not a diagnosis, not a dollar sign, not a cog in the machine. And I think by making people feel that in their bones, different, valued, and special, is key. And just to take it out of healthcare for a minute, I'll give you an example. One of the only stores that I used to shop in was Express. And the reason for that is because every time I walked into that store, without fail, the general manager, Michael, would say, "Hey, Valerie, how are you? What brings you in today?" He made me feel like $1,000,000 when I walked in, and all he did was he used my name, he used it often, he always greeted me with a warm smile, and he said, "What brings you in today?" He would even offer, he's like, "Are you going on a trip? Do you have a special presentation that you're doing? Are you doing a webinar? Like, what's going on?" And, there was a particular time where I was like, "Actually, I have a funeral I have to go to." And he was like, "I'm so sorry, like, please go to the dressing room, like, I'll get you your size, I'll get you all set." And this is just like any other store that anybody would shop in, but yet he's making me feel so good. And it's because of that that I can share this story now with you. I share it with family, I share it with friends, and it makes such a huge difference. And he did something so little on such a basic human level that was so impactful. So I think we need to get back to the basics to really be able to differentiate ourselves from our competitors.
I love that about the caring, relating as people to people, that wow, delighting in your customers. I love how you shared just a simple example, knowing someone's name, the power of
Yeah.
that. But how do you I don't want to get in the weeds, but like how you're dealing with so many providers. So how do you execute this? How would you help an organization execute this? I mean, I imagine there's training. I imagine there's a lot of different layers to make this happen, this wow factor happen. I'd love to hear a little bit about that.
Yeah, sure. So I would say initially, because we partner with all of these medical groups, is it's really about just first and foremost, like we just discussed, building that relationship with them, understanding what are their pain points, right? Just like I would for a patient, understanding what's working well for them, what can we capitalize on, and really just understanding where they are at in this experience continuum, right? I think everybody thinks, patient experience is so easy. It's just about smiling, making eye contact, using that person's preferred name, but it really goes so much deeper than that. And, if you don't have the right culture, if you don't understand an organization's culture, what's that saying? Culture eats strategy for breakfast, right? Like, if you don't truly understand, and if you don't truly build those relationships first, there's nothing you can do moving forward. So you had said, oh, maybe there's a lot of trainings. The reality is the first and foremost thing that I do is I just inspire. I bring them back to their roots as to why did you get into healthcare to begin with, right? What's your purpose? Because at the end of the day, they're human beings too, and they're deserving of a human experience. And being able to resonate with them and drive that deep intrinsic motivation, bringing them back to it, that is what brings the outcomes, right? You could train somebody all day. You could, what's the saying? Bring a horse to water. They're not going to drink it, right? But if you can inspire them and engage them, and then they say, okay, tell me more, right? Then that's when we can really begin to talk about more of those psychological solutions and those approaches of how to meet patients where they're at. But if you don't get to someone's like soul first, right? Like, why are they doing this and their purpose? Then it's going to be for naught.
I love that. And when you said engage, this is what I love about Planetary Health First, Mars Next, our show. We are engaging our audience and they're engaging us. It's a dialogue. And there's a lot of friends out there that you have, a lot of colleagues, and they're reaching out. And I mean, just from the one little comment, what? Chickens? I don't know if
Tony.
you know. Yeah.
I love Tony. She is absolutely fabulous. You need to go to her for any type of experience design, expertise, or execution. She is your go-to. She is fabulous.
And that's context. And then I guess we have Paul.
Oh,
You might
Paul,
know.
how wonderful. I do. Yeah. Paul is actually a vendor for Advocor, and he runs the whole business essentially. And I say vendor, right? And I just said that purposely because he is not like any other vendor. He is a true partner and he works with you. And just like I was saying about building those relationships, Paul and I have built a great relationship, and I'm not even a customer of his, but we'll go back and forth and have great, wonderful ideas. And it's only because I am not in the hospital setting anymore.
Help me out real quick, Valerie. What is the FONK, the fear of not knowing? Tell me a little bit about that.
I don't know if I could. Maybe
Okay.
Paul might have to jump in a little more
Paul,
for that.
I guess you'd have to type some more about that. Like, tell us a little more of what the fear of not knowing, what that means, Paul. That's great. Love that. And then, we have some other valued and special.
Lauren's wonderful too. Yeah. Hi, Lauren. Thanks for joining. This is awesome. This is great with the chat. I'm loving this. Yes. Getting to others' intrinsic motivation is so key. I'm a firm believer, you cannot motivate anybody to do anything. You have to be able to inspire them, whether that's through powerful storytelling, whether that's through having psychological safety and being able to share your own self, right? Having that humility. And then that's when others see you as a human being, right? You're not putting on a front, you're not putting on this facade. And when you can build that relationship with somebody else and inspire them, now all of a sudden they've made that connection of, okay, now I'm going to motivate myself, right? Whether it's getting somebody to quit smoking, getting someone to start running every morning, right? Like they need to make that decision for themselves. Brian, building loyalty. Yep, I love it. We're getting a lot more. Oh my goodness. Yeah. Owen! Owen used to work for me, or not, we worked together. I wouldn't even say he worked for me. He did so much. Culture and the way it extends, not just from employees to the customers, but the internal culture. Internal culture is huge. And, as a director of patient experience, I'll be the first one to say it is the employee experience that matters. And Owen, that is such a good point, right? It all reflects inward and outward. Totally. Absolutely.
And we got Paul. I think he's doing the FONK. He's doing I guess, if you want to read it or share more about what we're seeing, that's Paul that brought up about the acronym for FONK. Fear of not knowing, for those who are listening via audio.
Oh, yes. Yeah. I love that. I'm going to start. I might steal that from you, Paul. FONK. I love that. FONK. That's right. It's all about managing and setting those expectations. Everybody that's listening, your audience knows I'm a broken record about that. If we don't manage and set people's expectations, we are leaving them to their own devices. We are leaving them to their own brain, to what they think should happen, which isn't necessarily what will happen. And now all of a sudden they're ruminating and they're thinking, oh my goodness, I've been waiting here for 45 minutes. They don't care about me. They're so rude that they haven't communicated. And do they just want my money? And now I'm so scared. Maybe this surgery isn't going to go well. Like, it just leads down this huge rabbit hole. But when you can just stop and take the time to inform and educate and communicate, it makes a world of a difference. And that's part of what I was saying earlier about going back to those basics, right? You want to be a competitive organization, get back to the basics.
So another question is, when it comes to focusing on the patient experience, what is something healthcare organizations should never do?
Yeah, I love the devil's advocate of what not to do as opposed to what to do. I would say the first three things that come to mind is, the first one is, as business owners, and yes, healthcare is a business, or any business for that matter, we need to stop questioning and judging your patient or your customer's perception of their experience, right? What is there? Three sides to every story, right? There's your perception, there's the person's perception, and then there's the truth. And for each individual, it is their truth. It is their reality. So for most patients, they find it difficult to judge the quality of medical care. And rightfully so. They don't have that education, they don't have that experience, right? They didn't go to medical school. So they don't really know how to judge a clinical decision. So what we find patients constantly talking about and evaluating, and we read it in the comments all the time, is that quality of service experience. And it's that quality of service experience that when they're saying, I felt that I was rushed, or I felt that they didn't listen, I felt they didn't explain things well, I didn't feel any compassion or empathy, I don't feel like I can trust that person, I felt that there was no teamwork, right? At the end of the day, as that business owner, or as that C-suite person, or you could be boots on the ground, right? You can't deny their reality and how they felt about it, right? You could say, oh, I can't believe they said I was rude. I was so sweet to them. I tried so hard. Like, that's great. And that's your perception. And you're entitled to it, just like the patient is entitled to their perception, right? It's not right. It's not wrong. It just is. In fact, that's how I feel about the saying the customer is always right. It's not necessarily that the customer is always right, but their perception is always right, because it's how they remembered it. It's how they experienced through their lens. So we really need to just eliminate questioning, patients' perceptions of their personal accounts. So that would be the first thing. There's probably a few. The second,
we have a few comments or
okay.
Engagements from the audience I thought was really appropriate. This was from Owen again. Never tell someone that's upset to calm down. Yeah,
That's a good one.
right.
That will never work.
And then Lauren with, yes, no judging their perception. I think you guys are all on the same.
Yeah. Acknowledging the bad, never ignoring it. That's right, right? And the bad, right? Whatever the bad might be, whether you believe it's bad or not, is really irrelevant, right? Like, you need to just apologize for the interaction, and make it valid. Again, make them feel heard and valued. Which gets into my second, is that organizations need to stop delaying even capturing and aggregating that valuable feedback, right? Even with the smallest of numbers. I can't tell you how many times I've been in a meeting where someone might say, like, oh, well, that N size, that's really small. So let's just hypothetically say it's 100 out of the 10,000 patients that they see. If that cohort, if that 100 was your mother or your grandmother or any other family member or friend, would you feel differently? Probably. But it goes back to the fact that when we start to objectify and see people as numbers, that all of a sudden we disconnect. And it's easy to disconnect, right?
Mm-hmm.
Because if you're creating that transactional rather than relational experience, then we're just looking at it as like paper or numbers on a screen. I always try to advocate and say, you don't have 8 complaints in the system. You have 8 people that need your help. Very different, right? Like being able to psychologically use the right words that inspire and ping people the right way to really drive that action.
You know
So
what I love I'm hearing as we're getting the engagement from the audience, a lot of these other certified patient experience experts, is that it's all about empathy and really caring and being on that journey with your customer, your patient, however we remember, I guess, too, when they're referring to health plans. But, and then what I would be curious as how do you champion that at an organizational level? Like, how do you get everyone at a community, whether it be at a provider group, to really wow those customers? I'd love to know how do you, it seems like if you get people pumped to be excited to do that customer service, is there anything that you found that's really effective to get everyone on board?
yes, I think the first thing is that you need to role model. You need to walk the walk, talk the talk, right? And I think that first stems from the fact that you need to not ignore your employees' feedback on what is and isn't working well. Again, it goes back to the employees first, right? Employees are the front lines. They are in the trenches. They are the boots on the ground. They're the ones creating that culture, right? So if your employees are not interacting well with each other, right? If they have no communication, whether it's clinical to non-clinical, or whether it's the physician interacting with the front desk or the nurse manager or whoever it might be, if I as a customer, as a patient, if I'm sitting in the reception area, not the waiting room, very different, right? Using the right language. If I'm sitting there and I'm catching these vibes of what's going on in the room and the vibes aren't very good, how do you think that makes me feel in that interaction? So to your point, how do you get everybody on that bandwagon, realizing that it takes a village? And if you're going to tout that experience is important for your patients, well, you damn well better make it important for your employees,
Mhm.
right? Because your employees, right, again, we're all human beings, they're going to see through that real quick, right? If you're
Mhm.
saying this is how our patients deserve to be treated, why wouldn't we treat our
Mhm.
employees that way? When employees feel engaged and they're actually part of improving that patient experience process, right? You're not just telling them what to do, you're having that feedback loop, you're getting their perceptions and their experience as well. Then, of course, they're going to feel more ownership to really deliver those positive patient outcomes. When they feel they're connected to your mission, right? Going back to their purpose, when they feel that, happy employees equal happy patients. So I think it certainly goes hand in hand, and you have to start there. The culture is key. I mean, if you think about any fabulous experience, any memorable experience that you've ever had, it was all about how those other people interacted in that environment and then how they interacted with you, right? Because we're all neurologically hardwired to want to be connected and intertwined with each other and, have those social, happy, fulfilling experiences, right? Having that trust, that psychological safety, that's all huge.
Well, Owen, I don't know if he's getting credit for attending, but I love you, Owen. You're awesome. I love what you said. If you don't hear your employees, they won't hear your customers. That is
That's a
awesome. I
good
love
quote.
that.
I
I
love it.
love that, Owen. And then the other thing I have, my dad's 90. He was at a nursing home, a SNF, recent rehab,
Mm,
however you want to call it. And I think what made that place amazing is I heard that that administrator did the rounds.
yeah.
How do you make the CNAs feel like they're heard and cared? Is the actual administrator, or however it is, it's that modeling of how those patients, those residents need to be taken care of. So I thought that was pretty powerful. And everyone, I said, well, what makes the difference? And they were like, I don't even want to need to mention the facility or the administrator name, but it was just totally that everyone was being heard from the
Hmm.
patient to the administrator. So I thought that was pretty powerful.
I love that. That's wonderful.
All right. Well, what we're at 24 minutes in. We got about 15 minutes and we got so much more in this experience. What are some things that you would think would be helpful to the audience that are probably people in your, healthcare administrators, some providers, some subject matter experts like yourself? What do you think are some important things that you would like to just share, best practices? Love to hear what you think.
Yeah. I mean, I think we're all kind of tired probably of hearing like tactical best practices, right? So the one tip that I would share, PX Pro tip, the one tip that I would share would probably be we need to stop trying to solve operational issues logically. We have for years, time and time again, tried to solve things with a logical approach when it needs a psychological one. So what do I mean by that? We touched on earlier how, I oversee CAPS surveys and HOS surveys and something like the health outcome survey, right, for HOS. Rather than leaving a patient to trying to understand what should this visit entail, right? Because oftentimes we'll see a patient will, visit their PCP and we'll see in the comments things like, oh, well, they didn't check my heart, or they didn't, listen to my lungs or anything like that. And well, it was a wellness visit. But if we had set that expectation up front of what a wellness visit actually entails, you would know it's not the same as a physical, right? So what I'm getting at is that rather than trying to logically solve that, psychologically solve that by being able to meet the patient where they're at. We have what's really nice is a campaign of make the most of your appointment campaigns that we run with a bunch of our partners. And basically what that is it's a card that we give patients upon check-in where we're saying your health is important. We want you to understand what visits entail. We want you to look over this. Tell us what excellent care means to you. Know that these are the things that we want you to remember. These are the things that we want to discuss with you. These are the best ways for you to access care, right? So it gives them something to sit with now in the waiting room. So going back to the earlier question, right, where I was talking about systemic wait time issues, now all of a sudden the patient psychologically, they're sitting in the reception area and rather than sitting there for, I don't know, could be, 30 minutes, could be 10, could be 5, but let's just hypothetically say it's for, 45 minutes. Now that 45 minutes is going to fly by because now they have something that they're interacting with, right? We have something for them to engage with, to write on, to think about what am I going to discuss in the exam room when I get there with my physician? Oh, these are the things I'm supposed to discuss in this type of visit. Okay, great. So now not only are we touching on the fact that it optimizes the patient-physician communication in the exam room, right? Because now they're both on the same page. Even the physician has a resource of what to look at, right? Because now they know what's important to the patient, and it helps that visit to go faster. Right? You could have the same 45 minutes if you just let someone sit there and again you leave them to their devices and they're just looking around the room. That 45 minutes is going to take forever. But if you give them something to engage with, something to think about, now all of a sudden we're taking a psychological approach as opposed to, oh, we're having the patients wait for 45 minutes in the exam room. All right, we got to operationally change up the schedule. We got to make sure that each patient only has a 10-15 minute visit. We got to make sure we stay on time. So if you do have to rush them out, no. It's healthcare. It's unpredictable. Things are going to happen, right? So you can't logically solve that because there's always going to be something that pops up. But psychologically, meeting patients where they're at, understanding their pain points, now driving preference to them to how they want to engage, looking at something, educating them, informing them. Now we're changing the game. So thinking of more solutions like that, as opposed to let me logically do something that time and time again is just, what's the saying? You do the same thing over and over again. Like, isn't that the definition of insanity, right? We need a different approach in healthcare. So I'm not going to sit here and tell you that, rounding is the answer. Obviously, that administrator example that you gave is doing really purposeful, effective rounds and getting everybody involved, which is wonderful. But if you're not doing it purposely, if you're not doing it effectively, if you're not doing it with the vigor and the drive to actually want to improve, then that might be a detriment because now people are just going to see you're just trying to do it and you have a facade and this isn't really genuine. This isn't very authentic. Right.
I love what you shared about making the most of your appointment. Is that something that is done at different channels, whether it be, tablets? I mean, what does it look like for different demographics, or is it just a piece of paper? I mean, how does that work?
It's a great question. So primarily at Agilon, I'm working with the senior population. So we actually physically give them a piece of paper and a pen, and we find that to be incredibly effective.
Yeah, that makes sense. You don't want you want to make it really accessible, right?
Yes.
You know,
And,
like
and and I would say from a kinesthetic standpoint too, right? Like when you actually take pen to paper, like it's better for memory. There's continuity of care. They can take this with them now, right? It's not
Mhm.
something that's stored somewhere electronically that now all of a sudden they have to remember their login or their password, right? It's again back to basics, really like old school stuff that when done well is effective.
That's super. It's I love it. Just simple and empowering. Um, do we have some more questions? The most I'm trying to. I think we. Let's see. Oh yeah. So we got another question or statement from the audience, Mr. Johnson. The most dangerous phrase for healthcare is "We've always done it this way." I think that's for
Right?
everything, right?
Totally. Getting stuck in old habits or getting stuck in a comfort zone just because it's comfortable, right? We've all been in relationships where we stayed 1 month, 1 year, 10 years too long, right? Because we were comfortable. We got to start thinking outside the box. Yeah.
So what gets you excited about your role and kind of obviously you're always learning. What are you doing and seeing this experience with the patient experience, like, you know, one, what are you doing to sharpen your axe, and where do you see the future of this at your organization or just in general in the next year or two?
Yeah, that that was a lot of questions. So let me so sharpening my axe, right? I'm part of the PX community, and I'm I'm a founding member, and Denise Weissman, she is our founder and the chief community manager. And basically, I get together with this group of amazing experience practitioners, right? It's like a Rolodex of all of us across the nation, probably some global actually. And it's in online, it's this virtual space where we can all create a ruckus to make a difference, is the saying. And basically, it's really influential where we're breaking down silos, we're collaborating, we're not competing, we're really being able to meet formally or informally. We create resources such as like YouTube videos to really understand things like scoring methodology, you know, percentile rank versus top box or linear mean, or we're creating journey map templates. We're discussing various different healthcare topics that are quite frankly the elephant in the room that people don't want to discuss, right? Because it's taboo, or you know, but we can all relate. Or we're having online
Yeah.
events where you can learn about different patient experience vendors or free webinars, and like you were just saying, all those learning opportunities help to sharpen my axe. And when it comes to my role and what I do, what I love and what fills my cup is nationally just being able to work with all of these different physicians and all of these different medical groups, and being able to think about like the bias that people might have about larger groups or smaller groups, and how it really is a bias until, like any other relationship, you get to know the person. You don't judge a book by its cover. And I've got to tell you, everybody is very different, right? Everybody has their own culture, everybody has their own nuances and situational things that are going on. But at the end of the day, our partners are partnered with us because we've also vetted them, right? And they have the best intention. Like some of these physician leaders that I work with are just phenomenal. And to be, or even some of the C-suite leaders, we have a partner where one of the COOs calls the patients that are dissatisfied. He'll
Mm.
call them himself. And that in of itself, but before he even gets into whatever the issue is, when he picks up the phone and he says, "Hey, it's so and so, the COO," they're like, "What?" Like they're blown away. And you know, he can get a comment that comes through at, you know, 6:30, 7 o'clock at night, and he'll call them and be like, "Hey, this is really good feedback. Like, thank you so much. Like, we're going to take this back to the drawing board." And they love it. So to your point, filling my cup is just being able to see that as much as you see all over LinkedIn how broken healthcare is, there's still a lot of really great people and
Mhm.
amazing individuals that are truly transforming and making a difference. And I don't want us to lose sight of that, because at the end of the day, that hope is really what we have, which will then inspire and drive that inspiration for others, just like you're doing now. So, very grateful that we're even chatting and being able to, spread the word like this, because I don't want it to be undervalued. Like, it makes such a big impact and difference. And the more we can spread the news, spread the word, the better.
Well, I've been waiting, but you were just going, and
Sorry.
you were awesome. But that's why you're here. I'm not here to be talking. It's people like, our special guests like you. So Valerie, Denise was giving you a shout out.
Oh, thank you,
She's put on
Denise.
the screen that you rock, and then she gave you a little emoji, a little
Love
love,
you too,
little,
Denise.
yeah.
She's phenomenal. She had said to me, "Hey, do you want to help us out with the patient experience community?" And I was like, "Heck yeah, let's go." Like, you want me to jump how high? Because it's truly needed. Because you know what? Like, experienced professionals, or anybody in healthcare really, I think often those silos that are created, and then how you feel yourself as an individual, there's a lot of times not a lot of resources and patient experience. So it's really nice to have somebody to lean on, right? Somebody that's in your corner. Denise is one of those people for me, right? That I can be my authentic self. We have psychological safety where we could debate, we could disagree. And at the end of the day, I'm not ruminating and, how toxic culture is, right? Like, oh no, did I say the right thing in that meeting? Or should I have done this? What I could have done that better? Like, no. Like, we are just here to make a difference. We don't have to agree. We can disagree respectfully, and that's okay, right? That's how the best ideas are created, right? We need to have diversity. We need to have, people be dynamic in the way that their experience and how they can bring their authentic self to the table. At the end of the day, if we don't have that, then what do we have? Like, why are we meeting?
Yeah,
So,
I feel like you're sharing your community, your tribe with your ruckus, creating a
yeah,
ruckus is really just accelerating, diffusing the way, the mindset that we all need to have as a provider
yeah,
or clinician in healthcare. So it seems like that's what it is. It's like trying to make us all, we need to get in the game and get excited. So it seems like that's one of the biggest things that I'm hearing from you as a community, that you're building each other up and also empowering and educating. So I'm pumped up just hearing you guys. So it is, there's a lot of negative in healthcare, but in the bottom line is it's about the patient, doing the right for the patients, and getting the providers ready to do every day. So um,
that's right. Yeah. A human experience at the end of the day for everybody. I think people have that bias too. It's, oh, the provider this, oh, the manager that, oh, the employee. And because, right, we say that it needs to be patient centric, that the patient needs to be at the center of everything we do. But again, we are all humans. How could we possibly do that until we deal with our own internal stuff, whether that's through the business or just as an individual? We all have our own trauma. We all have our own things that we're going through, and that will certainly transpire to others, whether it is your internal customer, a coworker, or an external customer, your patient. So until we really, get to the psychology of that, and that's a whole nother live session, um, we're not going to make much improvement.
So, this is going to be an odd question, but is there anything you saw when you were like 6, 7 years old that you reflect that Jungian experience? Because we've been talking a lot about psychology. So I'm just throwing it out there where you look back at what you're doing. And obviously, it seems like you're delighting. You found your passion. Do you see anything as a child that really you connect with now as your profession?
Yes, absolutely. And that would be my nanny, my grandmother, my father's mother, who raised me. And to your earlier point about nursing homes, and, she was a resident. And when she got there, they coined her as a walkie-talkie. She was walking, talking, loving life. And then all of a sudden it was, oh, you can't be walking everywhere. You're a fall hazard. So where did they do? They put her in the wheelchair next to the nurses station. And she really started to decline, and the Alzheimer's, and she was losing a lot of weight, and it was really sad. But let me tell you, that's my purpose for healthcare, is because I would visit, and they would say, oh, she's not eating. And I'd say, well, did you take the time to feed her? Like, what are, no, she doesn't want to eat. We're not going to force her. Like, that's the answer. Okay. So again, that psychological approach, right? And I was young, and I would take her outside, I would play music for her, and I'd say, "Nanny, it's time to eat." "No, don't give me that garbage processed food, it's disgusting, leave me alone." And I'd say, "Nanny, come on, just one bite." And she'd have one bite, and I'd wait a few minutes because she'd forget, and then I'd say, "Hey, Nanny, it's lunchtime, time to eat." And then I'd give her another spoonful. She'd forget, right? And I would just keep, and then long story short, she ate all the food. But I think what was so pivotal and what blew my mind is that nobody took the time to do that with her. They all knew who she was. They all saw her journey and her demise, essentially, like where she was going. And not one person took the time to be compassionate, right? Like we talk a lot about sympathy and empathy, and that's great. But if you're not acting on those feelings, what good are they? You have to have sympathy and empathy and work on that by driving compassion. Compassionate care is that action, right? It's not just feeling, it's what you're doing. And I think that in that moment, I was like, wow, like we are all getting older. We are all going to be probably in a nursing home, right? We're going to be that resident. Like, is this what I want for myself? Right? Like, is this what I want for my parents? Like this is really something we all need to think about because every minute we're in this live session, we're all getting older. So we need to fix it and we need to
Mhm.
disrupt it and we need to fix it now because
Wow.
we need
You
to
just
transform it.
you just like read the question in your out of your mind. So how do you disrupt the status quo in healthcare? And
Yeah. Have those difficult conversations, being able to disagree, being able to have psychological safety, being able to meet with others and not have siloed thinking, being able to cross collaborate, create those relationships, being able to get down to the fact that again, human beings dedicated to taking care of other human beings. Like you were saying earlier, it has to be a community, and the PX community, thepxcommunity.com, right? That's where you can find us and you can join us and learn more. Connect with me on LinkedIn. Always love to have this amazing conversation with everybody because it is very much needed. I mean, there's really experience is the differentiator. Again, going back to our title, like if you don't have a good experience, you don't have a leg to stand on.
well, this has been awesome. I'm so glad you said yes and you came on.
Thank you for having me. It's been a pleasure. This has been so much fun, and I love how you're popping the questions up and people could chat like that. That was really cool because I was not expecting that. That was awesome.
Well, thank goodness it worked, you know? So we are coming to our end. It's been an amazing time with Valerie, who's, you just blow me away with all your positive energy.
Thank you, Michael. Thank you so much.
And so I'm going to close with our friends. It's been such a great journey today on Planetary Health First, Mars Next. Feel free to follow us. Just type in Planetary Health First, Mars Next on the internet. Until next time.